Today, I want to talk to you about needle stick and exposure to body fluids. Needle stick and exposure to body fluids can have profound impact on our mental and emotional well-being. It creates a sense of uncertainty, brings down a cloud of fear, and challenges the success of our future. It creates apprehension and heightens anxiety. Today, I will focus on the exposure control plan and specifically post-exposure evaluation and follow-up. The Occupational Safety and Health Administration, commonly known as OSHA, enacted the Blood-Borne Pathogens Standard in 1991. Its purpose is to promote safe work practices and to ensure that all workers are protected from exposure to human immunodeficiency virus, known as HIV, hepatitis B virus, and hepatitis C virus, and other disease-causing pathogens in human blood, body fluids, and tissue. So what is occupational exposure? It is contact with blood, visible bloody fluids, and other body fluids such as semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, peritoneal fluid, pericardial fluid, and amniotic fluid, tissues, and laboratory specimens that contain concentrated virus, to which standard precaution apply and during the performance of an health care worker's duties. The exposure control plan. Let's talk about the exposure control plan. What does it include? The exposure control plan is a key document to assist organization in implementing and ensuring compliance with the standard, thereby protecting employees. This exposure control plan includes, number one, determination of employee exposure. Number two, implementation of various methods of exposure control, including universal precautions, engineering and work practice controls, personal protective equipment, and housekeeping. And number three, ensuring hepatitis B vaccination for all. Number four, post-exposure evaluation and follow-up. Number five, communication of hazards to employees and training. Number six, record keeping. And number seven, procedures for evaluating circumstances surrounding exposure incidents. Transmission of blood-borne pathogens, including hepatitis B, hepatitis C, and HIV viruses, from patients to healthcare workers is an important occupational hazard faced by healthcare personnel. The risk of blood-borne pathogen transmission following occupational exposure depends on the following. Number one, source patient factors. That is, the titer of virus in the source patient's blood or body fluid. Number two, the type of injury. Number three, the quantity of blood or body fluid transferred to the healthcare worker during the exposure. And number four, the healthcare worker's immune status. The greatest risk of infection transmission is through percutaneous exposure to infected blood. Nevertheless, transmission of hepatitis B, hepatitis C, or HIV after mucous, membrane, or non-intact skin exposure to blood has also been reported. The risk of transmission of these pathogens through mucocutaneous exposure is considered low or lower than the risk associated with percutaneous exposure. Intact skin is an effective barrier against HIV infection, and contamination of intact skin with blood or other potentially contaminated fluids is not considered an exposure and does not require prophylactic treatment, known as the PEP. What defines a true exposure to blood or body fluids? Number one, bite. A human bite sustained by a healthcare worker from a patient, other healthcare workers, or a visitor. Number two, blood-borne pathogens. Pathogenic microorganisms that may be present in human blood and can cause disease in humans. These pathogens include, but are not limited to, hepatitis B, hepatitis C, and HIV viruses. Number three, healthcare worker. A person who works in the facility, whether paid or unpaid, who has the potential for exposure to infectious materials, including body substances, contaminated medical supplies and equipment, contaminated environmental surfaces, or contaminated air. Then number four, hollow bore needle. Needle such as hypodermic needle, phlebotomy needle, with a lumen through which material such as medication and blood can flow. Number five, mucous membrane exposure. Contact of mucous membrane such as example the eyes, the nose, or mouth with the fluids, tissue, or specimen. Then number six, non-intact skin, such as areas of the skin that have been opened by cuts, abrasions, dermatitis, or chapped skin. The modes of exposure. The modes of exposure include the following. Number one, percutaneous injuries. Any object that can penetrate the skin, including but not limited to needles, scalpels, broken glass, broken capillary tubes, and exposed ends of dental wires. Number two, mucous membrane exposures. Number three, non-intact skin exposures and bites. What should be done immediately if exposed? A few things. Wash needle stick and cuts with soap and water thoroughly. Then flush splashes to the nose, mouth, or skin with water. Irrigate the eyes with clean water, saline or sterile irrigants, and report the incident to your supervisor and immediately seek medical treatment. So let's talk about the post-exposure evaluation and follow-up. It's the PEP, post-exposure prophylaxis, PEP, post-exposure prophylaxis. It is recommended when occupational exposure to HIV occur. It should be given as soon as possible within 72 hours of exposure. The goal is to start within 1 to 2 hours. The HIV status of the exposed source patient should be determined, if possible, to guide need for HIV PEP. The PEP medication regimen should be started as soon as possible after occupational exposure to HIV, and they should continue for a 4-week duration. Post-exposure treatment is for males, females, pregnant females, and females of childbearing age. The United States Public Health Service suggests that the PEP can be offered up to 1 week after exposure. The combination of Truvada plus TVK, or the combination of Truvada plus Icentris, are two regimens that are commonly used. The side effects of these medications include nausea and vomiting, diarrhea, difficulty sleeping, dry mouth, headache, rash, dizziness, fatigue, and pain. The organs of concern are the liver and the kidneys. Documentation. Document the routes of exposure and how the exposure occurred. Identify and document the source individual. Unless the employer can establish that identification is infeasible or prohibited by state or local law. Obtain consent and make arrangement to have the source individual tested as soon as possible to determine HIV, hepatitis C, and hepatitis B infectivity. Document the source individual's test results were conveyed to the employee's health care provider. If the source individual is already known to be HIV, hepatitis C, and or hepatitis B positive, new testing need not be performed. Let's talk about testing. Baseline and follow-up serologic testing for HIV should be performed in all healthcare providers exposed to HIV to see if seroconversion occurred. The majority of individuals who seroconvert will do so within the first 3 months. Testing should be performed even among those receiving the PEP. All exposed individuals should have a baseline HIV test immediately after the exposure. Follow-up testing can be performed at 6 weeks and 4 months post-exposure if a fourth-generation antibody-antigen test is used. By contrast, if a test that only measures antibody is used, repeat HIV testing should occur at 6 weeks, 3 months, and 6 months following exposure. An antibody-antigen test is preferred since this test will detect seroconversion earlier. Extended follow-up for HIV testing, example for 12 months, is recommended for any healthcare provider who becomes infected with hepatitis C after exposure to a source co-infected with HIV and hepatitis C. Signs and symptoms of acute infection. The most common manifestation of acute HIV infection are fever, lymphadenopathy, sore throat, myalgia and arthalgia, diarrhea, headache, nausea and vomiting, rash, oral genital ulcers, and when the illness is prolonged, weight loss. The usual time from HIV exposure to the development of symptoms is typically 2 to 4 weeks. Well, medical providers, please note, if you have any questions about proper medical treatment for workplace exposure, please call the clinician's post-exposure prophylaxis line at 1-888-448-4911 or go to the website as displayed on the screen. The information presented came from the Center for Disease Control and Up to Date. Well, thanks for watching. Please remember to like, share, and subscribe. I wish you well. Good night.